Hi everyone, thank you for coming today to our session. So I will be starting the talk. And let's start with the first slide. So as Ines said, like today is our goal is to understand mast cell activation syndromes. But first, to do that, we need to understand what are mast cells, right? So mast cells are special immune cells that are found in different part of the body, especially in the skin, lungs, gut, and the blood vessels. They play a key role in defending against infections, healing wounds, and keeping things running smoothly in the body. So we can say that mast cells are known as police officers of the immune system. What they do, they are spotting signs of trouble and calling for backup when needed. So in a healthy state, mast cells release mediators that create a number of protective responses in the body to help fight infections and promote healing, as we said. But in someone with MCAS, in some cases, so where these mediators are released too frequently, they can affect the body in multiple ways, causing multiple symptoms in multiple organs in the body. So some of these mediators that the mast cell releases in the body include histamine, leukotrienes, tryptase, heparin, prostaglandin. I hope I'm pronouncing it right. Those are a bit hard. So as we said, those mediators help the body fight infection and heal injuries, but when too much of them are released, can cause chronic inflammations and other symptoms in the body. So they are not bad by themselves, but too much of them creates a lot of problem in the body. So when they are dysregulated. Next slide, please.
Of course.
So now let's talk a little bit about some of these mediators' effect on the body. We start with the most known one is the histamine. We hear about it a lot. So this one is called the allergy and inflammation chemical. So it is one of the most known, well-known mast cell mediators. It is responsible for common allergy symptoms. I'm saying only when it's released too frequently, when we have too much of it. So it causes itching and hives. So because histamine irritates nerve endings in the skin, causing itchiness and rashes. It also dilates blood vessels, making the skin look flushed. Sometimes it increases mucus production in the nose and sinus. So that's why sometimes you have lots of people with MCAS, me, more specifically, I always have the symptoms of chronic sinusitis. It stimulates acid production, leading to acid reflux in the body, and also nausea and bloating. This is impact on the IG system. The other mediator is the prostaglandin. It is the pain and fever mediators. So it increases pain sensitivity, trigger fever and body aches, and cause inflammation and swelling. The third one is the leukotriene. So leukotriene are responsible for airway constriction, so leading to asthma-like symptom and shortness of breath when it produces a lot of it. And it also increases mucus production, making breathing more difficult. Another mediator is tryptase and heparin. They're responsible for blood and tissue repair. Tryptase can break down protein and contribute to inflammation, whereas heparin is a natural blood thinner, which can lead to easy bruising and excessive bleeding in some people with MCAS.
Slow healing.
Yeah, that's why. So as you can see here, those are only some examples. There are hundreds, I think, of mediators from mast cells, and each of them is responsible for different role. And when they are dysregulated, they don't do their job properly. We have all these different type of symptoms and struggles. So those are here, just like I wanted just to say some examples. Of course, there are some more. Next one. Now we go what are the causes of this mast cell activation. For now, we don't really know exactly what causes it, but like it can be triggered, it can be caused by several things. First of all is genetic predisposition. Some people inherit genes that make their mast cell more sensitive, and also mutations in detoxification related gene like MTHFR can make it harder for the body to clear out toxin, leading to mast cell overreactions. So when your body cannot really get rid of the toxin in a proper way, so it increases the load for the mast cell to be able to deal with it, and since the toxins are still there, so the mast cell need to overwork for that, which is cause dysregulation in the body. And other things can also trigger mast cell, like environmental triggers, like exposure to mold, infections, viruses, sometimes bacterial overgrowth, getting exposed to certain chemicals. Sometimes some medications, actually, they have like some side effect, they impact the mast cell. Sometimes also physical trauma and emotional stress, which trigger your sympathetic nervous system. When you have too much cortisol, when you have so much stress, so it's also like make your body believe that it's under attack. And also then the mast cell need to defend yourself, even if you don't have an actual enemy like virus or bacteria, but your stress response make your body believe that there's something need to defend against. And the third one is immune system dysregulation. For some people that have autoimmune disease, since mast cell is also an immune cells, when there's some dysregulation in one way in the autoimmune, it will impact the other system, right? So also it will impact MCAS and will be overreactive and leading to all the symptoms that we talked about. And those are what can trigger what can lead the mast cell to be dysregulated, right? And dysfunctional. And the next slide. And the next slide, you feel like, okay, if you have already unstable mast cells, so you can have lots of trigger in your daily life that can make your symptom worse or increase the level of chemicals that in the body. For example, we have like food triggers, like high histamine food, like aged cheese, fermented food, alcohol. Some food additive can provoke symptoms, sometimes also gluten, lactose, soy. Why? Because if you already, your body is full of histamine. When you eat food that contain all histamine, so it's like your body cannot get rid of it, and it's already overloaded by the histamine, so your symptoms will just get worse. And as you said, like the thing that can create the mast cell activation syndrome can also make the triggers worse. If you get like more exposed to mold, pollen, chemicals, even pet hair. Like Ines is really allergic to cats' hair, unfortunately, and I love cats. And also
I love cats too. It's just that it's a toxic relationship due to chemicals. Dogs actually are fine for me, so I would prefer to have dogs. But I love cats, and it really hurts that I cannot, be friends with them. Sad.
It is really sad. And perfume also, so we try to have everything without added any scent to it, because some smells will trigger a reaction. For us women also, hormonal fluctuation really impact our symptoms, like high level of estrogen, particularly during like menstruation. Sometimes actually pregnancy can be also a cause, a huge trigger for women. Some women really have severe symptoms during their pregnancy and gets a very long time to get over it. Hormone therapy can also impact it or increase all of these that can increase the mast cell activation. As I also mentioned before, stress and emotional factors are major triggers. Temperature changes, heat, cold, and sudden weather shift can really provoke lots of symptoms. So you flare wherever there's this change. Apparently our body cannot handle to adapt very fast. So in case of doubt, just flare. And one, like, I was really surprised to have it as a trigger of MCAS, like it's exercise and physical exertion. When you push yourself too much, also your mast cell get overactivated. The next slide, please.
Of course.
Or do you have anything to add on this slide?
I think like anything can be a trigger, like even like trauma or some accident that happens at work or something like that can trigger your body response. Like once your body thinks that it moves into a parasympathetic nervous system, like really anything can be triggering. So it's very good for us to understand that sometimes maybe we think we're sick, but actually it's something more than that, and it's our mast cell, and then we have a protocol or some kind of ways to manage it, which we will talk about later. But one of the key symptoms that you can notice is immediately, like you have maybe your GI symptoms are worse. Maya, you can talk more about what are these symptoms that you can they overlap with cold, even sometimes with COVID. So you don't know what's wrong, and this gives you an answer sometimes. It's like, why am I feeling this way?
Yes. So now we talk about the common symptom of MCAS, and as we said before, it really impacts each one differently, and each time they're activated, they might be activated in different part of the body, since mast cell exists in all the connective tissue around the whole body. So some people, they have, for example, worse GI symptoms. Some people have worse respiratory symptoms, or as I said, like fatigue and joint, and like here we talk about the big umbrella of the whole symptoms. But like if you don't have all of this, or you have something else, it can happen because there's no standardized. But this is like the most common that we can see around people. First of all, like skin reactions like hive, flushing, itching, and rashes. We have gastrointestinal eye issues like acid reflux, nausea, bloating, diarrhea, and IBS. Cardiovascular symptoms like very fast heartbeat, low blood pressure, dizziness. Neurological and psychiatric symptoms like brain fog, anxiety, depression, and migraines. We have lots of misdiagnoses, like wherever sometimes you go, you have anxiety and depression. But anxiety and depression, they don't happen in a vacuum, without any other things. Sometimes they are symptom of a bigger question. And so we always need to try to find the origin cause and not try only to deal with the symptoms. So respiratory problem, like I talk about asthma-like symptom or nasal congestion, fatigue and joint pain. It's like chronic fatigue and fibromyalgia-like pain. And in a very severe reaction, we have anaphylaxis, which is a life-threatening reaction that requires emergency treatment. This is in a very advanced stage of the disease, where your body really overreacts and you have swelling, and some people can't really breathe, and this is really need immediate medical intervention in that case. Do you need to add anything on the symptoms?
I think if you think about the symptoms, you have to think about them like the major thing to understand. It's like it's multisystemic, so it comes from like the digestive system. It comes from the neurological system, it comes from the cardiovascular, and it comes from respiratory system. So when you have most likely when you start to have symptoms that from different systems in the body, then you can guess that your mast cell is flared. And sometimes also just getting a flu also triggers the mast cell. So not only are you having like flu symptoms, but you're also maybe the mast cell symptoms get worse because you're sick. Or even if you get COVID, you might get worse symptoms of COVID, like long COVID, because you have mast cell activation syndrome. So it becomes like a double trouble basically, because you're already on the edge, and then the disease or the common flu maybe comes, and then that triggers your mast cells even more, and then it increases your symptoms. So that's why when we also get sick, we get sick for a long time. We might be slow at healing. For example, you might get a cold, like someone who gets a cold in 2 days, they're fine. You get a cold, you're 2 weeks, you can't do anything. And that could be also explained by the fact that you already have a compromised immune cells. which is the mast cells, and you have on addition the disease or the condition that you have temporary. So it becomes really complex, but it can explain a lot. So it's good to understand that, like just put it into perspective.
Yeah, exactly.
So how do you diagnose this?
Yeah.
It's like, oh my god, the diagnosis is so behind. It's so sad that like these type of conditions that they don't get enough attention and like good protocols on how to diagnose. You know, when the condition is complex and it's mostly maybe women, then it's ignored as if like whatever.
Yeah.
But there are some ways you could do it.
Here we need to point out the challenges. First of all, like there's no single definitive test for that. There's no gold standard test for MCAS. Instead, like diagnoses rely on combination of laboratory tests, symptom history, and responses to treatment. And another challenge is the fluctuating mediator levels. So they're not always overreacting. There's something make them overreact and you have a flare, and sometimes if you don't have a flare, the level of in your body are like normal. So lots of us, we have mast cell activation syndrome, but when we go to do the blood test, all our lab tests are normal. So it's like, no, you have nothing. So usually you need to wait till you are in a flare to run to the laboratory and ask them to take your blood or urine at that moment. But it's very hard because if you're flared, you're really tired and you cannot do that. And to go there and have like a doctor paper to say like you need to take those, sometimes you're not really taken seriously. So it's really hard to take the test at the moment where you are really flared and that show the dysfunction in your body. So that's why like the most evolving diagnostic criteria, like research on MCAS in ongoing, but what they do usually, they just give the patient some antihistamine and like it's trial and error for now. But as you said, like now there's more research about it, and they're trying to have like more diagnostic guidelines. And usually like you need to go and see like other patients what they do. Like patients would have all patients would know more about what to do than normal doctors, and you need really to try to find a specialist.
Yeah. And you need to push for it. If you really believe this is something that you're struggling with, you need to kind of advocate for yourself and push for more tests and push for like several tests at different timelines, because timing is really a huge factor. So you really need to educate yourself, which is sad because we're already all of us struggling with so much, and then we have to sit and do all this work and advocate for ourselves. But that's we gotta do what we gotta do.
But in the state of the art, what are the main tests that they're done for now? First of all, is like serum tryptase level can indicate mast cell activation, but may not always be elevated. Because this is one mediator. 24 hours urine test measure histamine, prostaglandin, and leukotriene. Third one is like serum chromogranin and heparin level. Often checked to rule out other mast cell disorders. And the most important thing, in my opinion, that is used for now, so that respond to antihistamines. Some physicians use a trial of antihistamines to see if symptoms improve, which can be a clinical clue. So if you can improve on antihistamine, it means that you have some dysregulation in your mast cell, and that's the way to do. But for now, like the main thing is this is only like to understand if you have it or not, and for symptom management.
Yeah. So yeah, I can take over now. Thank you, Maya, for all of that. So like we talked about before, why are we talking about mast cell and why is it so important? It's because it's so connected to other conditions. Like we usually talk a lot about Ehlers-Danlos syndrome, also known as hypermobility more commonly. which I have and we talked about a lot. This is what ParaMotion is all about. So it's a common comorbidity for that. And also POTS, I know some of you guys that we've talked about POTS before have it, and chronic fatigue syndrome, small fiber neuropathy, autoimmune disorders like lupus or arthritis, or what was
Arthritis,
it?
yeah.
Arthritis, oh my god. And you have multiple chemical sensitivities and a lot of other conditions like the chronic urticaria and angioedema. So it's a lot of Latin words, you guys. Sorry about it. Mastocytosis as well.
Cytosis.
So um, you can see that like we don't. It's like the chicken and egg also almost like we
Yeah.
don't know which one is first. You know, is it mast cell that triggers all of these other things because of the chemicals that are produced over time. Maybe it leads to defect in collagen, which causes ADS. Maybe it leads also to the POTS symptoms, and obviously it leads to fatigue on its own. So which one started first, the MCAS or the other comorbidities? We don't know, and how they interact with each other is such a interesting topic. So we really need to understand a little bit how we're commonly misdiagnosed when we have this condition, and how it interacts with other conditions. So, for example, you might be hearing that you have irritable bowel syndrome, with IBS, anxiety, panic disorders, or even depression, and you have ADHD, autism. So all of that also has a physical component in the background, obviously, which can be mast cell, and fibromyalgia, and then chronic idiopathic urticaria, allergic rhinitis, and psychosomatic illness. And all of this, obviously, you might get diagnosed for it, but since they don't connect it to the cause or to mast cell, then maybe you're not handling it well with the treatment. So it becomes. You want to say something?
Yeah, I want to just say something like psychosomatic illness. It's they use this term, I think, when they don't know what's happening.
Yeah.
It's like, okay, it's in your head, or it's like psychosomatic. It's like just to be a fancier word than it's in your head. You have nothing. So there's lots of stories about patients. They go and they get gaslit in the medical system. That like because their lab tests are normal, because the lab tests are there to detect what's already known. It's not if it's everything is normal and you still don't feel good. It doesn't mean that I'm imagining my illness. It means that they need to go and do more research and think outside of the box. It doesn't mean that I am the problem. But unfortunately, in the medical system, this way of thinking is not really incentivized, and it's for me like the diagnosis of fibromyalgia and psychosomatic illness are the lazy way of doctors saying I don't know and just put a label on you. So
Yeah, I agree. It's like one of those things, like if you don't know, just say it's emotional or mental or something like this. But real doctors who really understand illnesses and the human body will understand that every psychological disorder has a physical component, and every physical disorder has a psychological component. You cannot separate them, and you have to treat them both with care and equally. They're equally important. So yeah, so what can we do now that we know what we know? We can avoid the triggers, obviously. We can also medicate for symptom control. We will mention a few of examples, supplements later. Natural supplements, and we need to support our mental and physical health. I think communicating with others, like once I knew about mast cell activation, I knew about my ADS, I know about my ADHD, my autism, all this collection of it becomes who you are at some point. Like who am I without these conditions, because it's impacting me on a cellular level. So I have to communicate that at work, with my friends, with my family. They have to understand it so that they don't think I'm maybe misjudge me or misjudge how I behave as like lack of interest or lack of motivation, rather than it's like a much more complex situation and I'm really doing my best. So I need support rather than judgment. And then gut healing and the detoxification with some diets and stuff like this. So we need to, obviously, as you can see, we need to approach it from different systems. We need to approach it by avoiding what can trigger us to the extent that we can. Obviously we cannot avoid everything, but to the extent the best of our ability. And then we need to medicate, and we need to supplement and support the mental and physical symptom, and also the GI symptoms with the gut, which is the microbiome. I don't know, Kathy was here, so this is where the microbiome comes. If you're here, Kathy. And then medications for symptom control. So examples, I take it when I'm flaring and things, I just can't control, I can't breathe. When you lose, like when you have sinusitis and you lose the ability to breathe, it's just downhill from there. Like breath is such an important factor, and not only shallow breathing from the chest. Like we need to learn to breathe really more actively with our entire torso. So antihistamines help with that. H1 is very good for the breathing when you get that breathing issues, and when you get the GI symptoms, H2 then it's very good. And examples for H1, I think any antihistamine usually. Loratadine, yeah.
I think.
And then H2 is like Pepcid or famotidine.
Famotidine, yeah, and Pepcid.
Yeah. And then you have the other chemicals that are released by mast cells. You can also experiment if maybe you have leucotine that it has is more released for you, so you can have inhibitors for that to reduce symptoms. And then you have mast cell stabilizers like cromolyn sodium and ketotifen, and which not only works as an antihistamine. Some people take it as antihistamine, especially ketotifen, but it's not working on just blocking the histamine, it's working on stabilizing the mast cell, which is even more important for us. It might be hard to get cromolyn sodium without a prescription, so just so you know. But if you can do, if you do reach a doctor that understands, you can say like, let me try this cromolyn sodium for mast cell stabilization.
I just wanted to highlight that cromolyn sodium is quite expensive.
Yeah.
So usually all doctors will try first with the cheaper options. So they start with H1, H2, the thing that you can have over the counter. And with time, they go for more expensive and more and harder to get drugs. So here is like trial and error, because even like if you use H1 and H2, as you said, like they have a different type of antihistamine. You have different brand, so you need also to change with the brand. Like sometimes I go to pharmacy, I buy one. Actually, it does nothing to me. It depends on the molecule that they're using. So it's also trial and error here. You need to try the several one and see which one that works for you.
Low dose naltrexone as well, LDN, for immune response and reduced inflammation. So even now we're reading even a book about mast cell, and it's a doctor who has treated like hundreds and hundreds of patients, and he says, unfortunately, till today, now it's like 10th of February 2025, we don't have a protocol. We don't have a solution that fits all, one size fits all solution, standardized solution or medication for mast cell activation syndrome patients. What we can do is experiment, trial and error, and obviously it's gonna be a while till you figure out which drugs work best for you, which brands work best for you, and when to take what. It's gonna take some time, so we need to be patient and try different things, keep an open mind, because it's still like if we avoid and not do anything, it's gonna get worse. So we need to a bit of trial and error. It's better than not trying at all. Natural supplements also are very good. For example, this you don't need a doctor at all, so you can start today if you want. If you feel like, oh, these symptoms I'm really struggling with, today you can make these orders and start already feeling better in your body and experimenting. And these are safe, so you don't need to worry. Quercetin, I love that one, especially it's a natural antihistamine and stabilizer of mast cell. It's very good for the breathing if you have issues with that. And vitamin C and zinc, it's very good to reduce inflammation and support immune system. Vitamin C is also really amazing. Even if you don't have EDS or MCAS, they recommend you to take vitamin C. So imagine in our case, you have to take even a higher dose, And you have magnesium. Everybody takes magnesium. So we just need to take it a little bit more. And more important, you can take one before bed as well if you struggle with sleep. Glutathione also is very good. It's master antioxidant that aids in detoxification, so that's very good for us with mast cell. Omega-3 fatty acids is very good for inflammation and immune system in general. And B vitamins is very good as well, B6, B9, B12. So all of this, you have a lot that you can do on your own. And me personally, with my sister, we take all of this on almost on a daily basis. And when you take a lot of supplements, maybe every 6 months or a few months, you can take a 2 weeks break to like reset the liver and stuff like this, and then continue. So this should be safe, and you can improve like right away. You can start to see improvements.
Yeah, but I just wanted to say as well, this is what worked for us after a while of trial and error. So I recommend like try with one at a time. So for like 2-3 days or like 1 week, and see if it helps you or not. If it doesn't help you, you don't need to take it for a long time, and then drop it and try something else. So you need to find the right combination for you. So try add one thing at a time, and give it some time to see if you feel better or not. Then you add another thing.
Yeah. And of course, every time I have to say the same thing, that we need to support our mental and physical health. Mast cells as well, they react to cortisol levels, they react to the nervous system, and that's why it's called ParaMotion, because we need to move from a parasympathetic nervous system rather than a sympathetic nervous system. And that's really the core of how we need to work on our movement, that our movement brings us like less cortisol and brings us more healing. It engages us with our breathing, with our muscles. It gives us access to the right muscles. It really wakes us up and activates us in a way that then we can stabilize our nervous system and reduce symptoms of mast cell, of EDS, of POTS, and all the comorbidities. So movement is essential. I recommend, even if you don't move at all, move 5 minutes every day. But you have to move every day. Say 5 minutes, whatever you do. I can show you now. I will show you and 2 exercises for the glutes, for example. You can do every day now for 1 week. After you do 5 minutes, maybe try 10 minutes, and then 20 minutes, and then 30 minutes. For me right now, like I work out 1 hour a day, and it's for me like brushing my teeth or having dinner. It's something that you do. Like you feed your body with food, you need to feed it with movement as well. So it's very important to create this habit, and just understand, like, even if I have to work out 5 minutes, it doesn't mean I have to do like hardcore training every day for 5 minutes. It can be, I breathe for 5 minutes, or I do a walk for 5 minutes, or I do like something gentle stretching, or dynamic stretching, or gentle, movement. And those days where I feel extra energetic, I can, do more hardcore strength stuff. So it's not like, okay, then it means that every day I'm hardcore. Every day your body is different, and you can adjust. But you need to do it every day, and you need to start building that habit. Everybody does, not only us with specific conditions. Everybody does, but for us, it's extra much. Like it's even extra important.
I just want to say the most important thing for us: don't push yourself too much, because when you push beyond your capability, you're gonna just flare and cause more harm to your body than good. So that's why it's very important, the idea of pacing, taking some rest, and gentle movement. Because we have this, as Ines said, like understanding a workout, I just like push, and like we should be sweating and stuff. No, you shouldn't. In the beginning, we need to build the mind-body connection, and we need to rebuild our relationship to our body. So just as I said, like sitting, breathing, being aware of our how we are sitting, and just very gentle movement. That's why we call it movement and not exercise. And how to be aware, what are you moving, like how are you activating the right muscles, understanding how the essence of movement. This is the main thing. It's not about pushing yourself and not being aware how you're moving.
Absolutely. And obviously when you move, you have to also think, when you're moving, you're not only impacting the muscle and the joints. You are impacting that a lot, but you're also impacting your digestive system, and you're impacting like the microbiome, and you're impacting, because when you activate the parasympathetic nervous system, then you are in rest and digest nervous system, and that's when you can create a lot of digestion. If we are always in sympathetic nervous system, then we don't digest as well. So that improves the GI symptoms as well as the neurological symptoms. You're improving also focus, ADHD symptoms, autism symptoms. So you don't think about movement as if, oh, I'm just doing it so I have muscles. Like, that's great. You will have muscles, of course, and that's amazing, but it's not the only thing. You will also have better focus, you will have better digestion, and it's gonna impact everything. And obviously you need to rest in those days that you feel like you need rest. You really need to rest, and it's something that a lot of us, I think, struggle with, that like take time off and regularly, like maybe work for a couple of hours, take 5 minutes off, just stare on a water wall, or like
Yeah,
whatever you need, take a
sometimes just
walk.
take 5 minutes to do eye exercise, for example. We ignore our eyes a lot.
Yeah,
Like
simple things like that.
some
Moving the
stretching.
eyes, it also activates the vagus nerve, which is connected to the parasympathetic, rest and digest. So you can also just move your eyes from side to side in circular motions, just like that, to activate that in the body. So there's so much you can do. It's just about, I think the hardest part is just creating the habit.
Yeah, it will take some time.
But once you got that, like, you're on your way. And of course we're here to help you. You can book me, one-on-one, or like register on our website. So we are here to help us as well, since we have gone through this. So
This one before.
yeah, here. Okay, so yeah, that's, I think, almost an hour, so we're finishing up here. I hope you guys understand more about mast cell activation now, and how it's a multi-systemic condition that we need to also approach in different angles, from avoiding triggers to using medication and supplements, healing the guts, supporting detoxification, moving, and as well, if we can get the right medical help, that's always a good thing. But there's also a lot you can do on your own. So I will open the floor now. If you guys want to ask us any questions, or you have any comments or feedback, please feel free.
I have a question.
Yeah.
So, is there a breakdown between the percentages of between men and women that have these issues? Mm-hmm. Is it more common in women or men, or is it equal?
It's more common. EDS usually is more common in women, and it expresses itself differently. Like, for example, in my family, me and my sister have it, and I have one brother who also have mast cell activation syndrome. He got diagnosed for it in Dubai when he was working there, but his symptoms are mostly like GI symptoms and skin symptoms and allergy symptoms, and not as much joint symptoms as much as us, for example, maybe because of the hormones. So I think it's not equal. Maybe women a little bit more, but I don't know if it's like women a little bit more because of our hormones, that it makes us have more symptoms, or that it's just a little bit more because women are more prone to having it. But there are, of course, men who have it, and a lot of them, actually. Maybe Maya, exact data.
I think it's very similar to EDS. The mast cell activation syndrome is 70% women and 30% men.
Yeah.
Around that,
yeah.
Well, and I know that sometimes as men, we may be more reluctant to seek medical care.
Yeah,
that is to happen. So you think that might impact the percentage?
Of course. I think, so for men, usually also there's connection with testosterone. Usually testosterone makes you have thicker skin, it makes you have build up more muscle easier, and it makes you, have EDS symptoms a bit less than us, since we have lower testosterone and higher estrogen, and estrogen creates more histamine creates more symptoms, so it becomes like also a hormonal thing. So maybe we struggle with it more, so we seek more help, rather than maybe men have it in a different way, so they seek less help, or they get maybe the wrong diagnosis even more, because maybe they focus more on their GI symptoms, or like different types of set of symptoms that doesn't show up maybe as much in the joints and in the muscles as much,
Okay. Yeah, that's very interesting. Do you think that women get medically gaslit and medical abandonment more than men, or do you think it might be the same?
From my experience, it's bad for both people.
Yes.
For both genders, it's bad
Okay.
for everyone. But women usually, it's they're not believed because of their because they have hormonal changes, a lot of hormones. So everything is blamed on the hormones. It's like an easy way to gaslight them. But like when a man comes in with extreme symptoms, then they cannot blame the hormones that easily. So then they have to look a little bit deeper into it. But of course, there is still gaslighting even for men. So I would say, like, to the
Yeah.
degree the which the gaslighting is happening a little bit more for women, but the gaslighting is happening for both in a lot of ways that shouldn't be happening for anyone.
Yeah, and it seems like a lot of this is tied, to your mental health.
Mm-hmm.
Your mental health affects how you feel, and your physical health affects how you, respond mentally. So it's like a circle.
Exactly.
It is a vicious
Exactly.
circle.
Exactly. And that's the key things, like, now I didn't understand before, but when I go to a doctor and they say it's mental, it's emotional, immediately for me, I stop. I know this doctor, there's no need to fight, there's no need, if I can change the doctor, I change it. If I cannot change, I leave. I don't want to come back to this place, because a good professional, especially a doctor, or even a mental health professional, any kind of health professional, will understand this, will understand that every physical symptom has a component in the psychological, and every psychological has a component in the physical. There's no separation. So when you deal with them as separate, then you are not qualified to handle this situation at all. So just like cut to your loss at that point.
And I think the problem also in
Oh,
our
wow.
medical system, there is like you need to look at what is the behavior that incentivized, right?
Mm-hmm.
So doctors, they have very short time per patient,
Yeah.
and they need to give a label at the end. Otherwise, it's not good, right? So they don't have this abundance of time. The system doesn't really incentivize, like, okay, let's take this to afford and spend the time that it needs, right? So you have very short time limit, and it's mostly you need to have a label and you need to prescribe something.
Mm.
And that doesn't really help because like each one is different, and sometimes you need to have it as a case of study to go and take the time that it needs with the test that it needs. And sometimes like you have lots of insurance refuse, like you don't have enough argument for some tests, they won't pay for it. So it comes a lot also of our health system, how it's constructed, and what's the behavior that incentivized. It's not for our health at the end, like it's not the number one goal is like for us to be healthy, right? Even though they pretend.
Wow.
Yeah, so it's a very complicated multi-layered problem, I think.
Yeah, it's true. Do you struggle with any of those symptoms, coach, or do you know of someone, or?
Well, I now that I'm learning more about this, I think I may know someone uh, that is probably dealing with this and just haven't been diagnosed. So, I'm happy for this information because now as I begin to talk with this person, maybe I can ask them the right questions and then steer them towards you.
Yeah, absolutely. We're happy to help. We're here. I think also, like, there's so much you can do on your own. So it's not like, oh, okay, I can't find a doctor to help me, then I don't do anything. Like, there's a lot we can do on our own as well. And without prescription. So you can also find people like me who are health professionals and can help you and guide you because of their own experience. So there's a lot
Right.
you can still do.
Great.
Awesome. Thank you, coach. Anyone else has any comments? You can write in the chat, or you can just unmute yourself, ask away any questions you have.
I also thought it was an interesting point that you mentioned the eye exercises. I never thought about that.
We did some, right, with each other when we activated the vagus nerve. Do you remember the class the one before the last, we did like the vagus nerve, and then we moved the eyes to the left, and then we could start yawning, and then to the right.
Oh, okay. Yeah.
Or we can also
But
use
we can,
with your hand guiding your eyes. Also, you can do other stuff.
and you can do other stuff, like you can, without laying down. I was doing it with laying down and stuff, and then moving the eyes as an extra. But you can do eye exercises on their own as well, and I will be posting more videos on eye exercises, so you guys can watch it and do it.
Okay.
And only one idea I would just to just emphasize that sometimes when you have multisystemic problems, if you have like so many labels, it's much more probable that we have one thing that caused all those problems than we are very unlucky to have many problems at once.
Right. Yeah, that definitely complicates it.
Mm-hmm.
Yeah, exactly.